Hi, this is Dr. Tom with another exciting technology. This particular technology was designed by a buddy of mine, Gene, and Gene has a company called Advanced Light Devices. What I really like about what Gene does is he's got a very visionary mind and he's always looking at making his stuff better. We connected a while back, and ever since then I've been using his lasers with a lot of different cases here at Causenta. What's really nice about this particular technology is one, it's got a very simple USB interface, so literally you could just plug something right into these receptacles here for USB. You could basically press a button and you can see how the light is coming on right away. In the event I want to make some quick changes, you can see how this guy's flashing right now. I could just disconnect it and you could just, it's that simple, easy in, easy out. What I like about the way he designed it is these things are, you could bend them and put them around different joints or locations around the body. So if, let's say if it was my knee or my elbow and I want something rounded, it'll flex and bend. If it's something like my back and I want more of a flat effect, you can see you just lay it down flat on the body. I've actually used this in the weight room when lifting weights. I've used this for people that had extreme pain and they couldn't move at all. So from whether you can't move or whether you're very dynamic with your movement capability, it's a great tool. The way it works is the red light that you can see flashing on my hand, it functions to get rid of inflammation in the body and reduce pain. It functions to increase different signals that help lower pain thresholds. And it also increases energy of our cells. So sort of like a lot of different benefits all rolled up in one. Depending on the exact wavelength, there's several wavelengths here, but different wavelengths also do things, stimulate immune function, help our body fight sort of bad guys that might be on the surface of our skin or in our blood. And so what we'll do with this technology is we'll use it for different types of people with different types of concerns. So let's say, for an example, an athlete came in, he's like, hey, I had a rough day at practice. He doesn't have any pain, but his muscles are just really sore. We can literally take some of these electrodes, or let's say maybe LED blocks would be a better term other than electrodes, and I could put them on the muscles that are sore or achy. And it'll actually get rid of inflammation in the muscle tissue so that the next day he can train hard again without sort of any penalties from the workout of the day before. So we can actually use this light energy to enhance recovery for athletes that are training hard. Now let's say someone's not an athlete, or it is an athlete with joint pain. So let's say their elbow or their knee or their hip or some part of their body is bothering them. We could use the same technology and wrap it around, it doesn't matter if it's a hand or a wrist, but I could plug it in, and I've literally used it with people with carpal tunnel pain, where I could have either two pads, like one above and one below the hand, or I could wrap it around, depending on the dimensions of the person. I could wrap something around the wrist. There's like these little Velcro pieces here that you could clamp, and it holds it in place. If, let's say, it was a bigger body part, I could put two of them together in series and go around, let's say, a thigh or a hip or something like that. And so what's really cool about this is within 20 or 30 minutes, I'll have someone that's in pain and they're totally out of pain and they're moving really well. For someone, let's say, that has cancer, there's actually different ways we can get these photosensitizer agents. These are things that we can apply topically, let's say for skin cancer, or something that they can ingest. So these are substances that will get inside of a cancer cell, and then we could take the same exact pads or equipment and apply that outside the body. And when photons of light from this wavelength hit those cancer cells with that substance inside them, there's really good research indicating there's something called a photodynamic effect. And what that basically means is we're using a photosensitizing substance, we're using oxygen and light to basically blow up the cancer cells inside of people. It's a very clever method. It's something that people with cancer that are trying to deal with those issues really appreciate, because there's no side effects. You don't have hair loss, you don't have any pain or brain or heart issues, no endocrine dysfunction. So it's a kind of technology that a lot of people really embrace, because they could see a difference in a PET scan or in a CT scan or some markers in the blood. They could also see improvements in their ability to move. So it's kind of like you look better inside and outside at the same time. Now let's say that you have neuropathy in your feet, and whether that neuropathy was caused by chemotherapy medications, or whether you have diabetes, or maybe had something post-surgery where there's like burning and tingling sensation in your hands or your feet, the same exact technology we would just apply to those body parts. So I've had people that couldn't walk because the burning in their feet was so bad. So physically there was nothing wrong in terms of the ability to control their body, but it was just too painful. So we would take these light pads, I put one on the sole of their feet, I put another one on the top of their feet, I would do that to both feet, and I'd run it for about 30 minutes at a pain setting, and afterwards they could walk and they would say, wow, I feel a significant reduction in the pain of my feet. And the nice thing about that, no drugs, no supplements, and it's when it gets to the point that you don't have any more pain, it lasts. I don't have people coming back again saying I have the same problem. So I would say it's almost like a permanent fix for many people. And so then a lot of times people say, well, can this have other applications besides, athletes or someone with cancer or someone with pain? And the answer is absolutely yes. These technologies are very impressive because they do a number of things that I think a lot of people are really interested in. One is I can take all these pads, put them like a belt in series, and go around my whole torso. And the red light actually can stimulate fat loss. And so that's something I think everybody's really appreciative of. The second thing is you can get rid of all kinds of inflammation in the spine and the hips. So people with back pain or people that they're just too stiff to move, we can actually have this technology around them while they're moving, and it actually becomes easier and easier for them to move. And as I mentioned earlier, one of the applications we use with athletes with this technology is to help with recovery. We could also do the same type of thing with non-athletes. So let's say someone has arthritis and they want to play golf, or let's say, but they're not competitive, but they just enjoy playing it every so often on the weekends. We could do this type of therapy before they play golf, and they won't have as many aches and pains after playing golf. So it allows people to enjoy their life without the repercussions of pain or stiffness that they may be experiencing right now. So hopefully you got a lot out of this presentation and you find some unique applications for your own health. If you'd like to find out how to use the multi-lumen for yourself, just go to Causenta.com, fill out the form on the home page, and then we'll get you scheduled right away to come in and try this new technology for yourself. If you or a loved one is suffering or dealing with an issue, and where that issue has a diagnosis or no diagnosis, or if you're just tired of coming in second place, just go to www.causenta.com and fill out the form where one of our professionals can schedule a call with you and review the options that we have. They're going to explain to you how we work and how we can help you or your loved one, and then just do what they say so that we can actually help you.